Hello, my name is Giselle Cordova, and I'll be presenting on histrionic personality disorder. For this presentation, we have our patient named Emily. Her chief complaint, as per the slide, Emily states that she feels like people only care about me when I'm the center of attention, and when I'm not, I feel invisible and unimportant. Emily is a 22-year-old African American female college student who regularly finds herself to be the center of attention. She has a bright and bubbly personality most of the time, but can get really upset when the spotlight is not on her. She thrives on compliments and validation and feels lost and underappreciated when she does not receive them. She goes through periods of intense highs and lows emotionally. She often changes the way she dresses and talks to match the interests of the social group that she's currently around the most. She tends to get overly attached to people and feel that she has created a deeper bond with a person than it might actually be in reality. Her friends and some professors have noted that she is often overly dramatic, and this has caused some conflict in her life, both personal and academic. Emily's mother also notes that this behavior has really started to worsen since she started college. Emily's medical history shows no signs of drug, environmental, food, or latex allergies. She's not taking any medications currently. She has no history of any chronic illnesses, trauma, or hospitalizations, no history of substance use disorder or any kind of addiction treatment. She hasn't had any formal psychiatric diagnosis or any hospitalizations. Family history-wise, her mother does report having mild anxiety, but is not on any kind of medication and has not been formally treated. The family has no known history of major psychiatric disorders, such as bipolar disorder, schizophrenia, or suicide attempts in any immediate family members. Patient denies history of tobacco use, drug use, or alcohol use. She is single. She has a part-time job as a retail associate. She lives off campus with her roommate, and she is a full-time college student. On the initial assessment of Emily's case and her complaint, her review of symptoms is completely normal. She's had no recent weight loss, fever, any kind of chills, no chest pain, no shortness of breath, no gastrointestinal symptoms, no excessive thirst or urination, no musculoskeletal pain. Her skin is normal, no allergic reactions. Genitourinary-wise and sexual function is perfectly normal. She's got no headaches, no dizziness, no numbness. Vital signs are stable and within normal limits upon examination, and so far at this point, no laboratory or diagnostic examinations were reviewed yet. In Emily's mental status exam, physically, her general appearance showed that she was dressed provocatively. She had very tight and short clothes that were very open and skin revealing. Her grooming seemed a bit eccentric. Her hair was a little bit out of place. Motor activities were normal. Her insights were a bit poor, with judgment impaired. She had a dramatic and rapidly changing affect, and her mood was congruent with that affect. She was oriented to person, place, and time. Her memory was intact. Her attention and concentration were impaired. She was talking very rapidly, making center of attention kind of ideas, making up stories. Her thought content was inappropriate during this time. Perception was impaired. Her flow of thoughts were impaired. The interview behavior itself was very exaggerated, but her speech was clear, not slurred. So, what is histrionic personality disorder? Patients with this disorder are diagnosed based on their need for attention, their over-exaggerated emotional responses, and an intense desire to gain the approval of others. Individuals with this disorder might behave very dramatically or flamboyantly to basically be seen as the center of attention at all times as much as possible. They might behave provocatively or behave in a way that seems overly dramatic just to attract attention, as we see in Emily's case. They tend to make a big deal out of things and falsely believe they have deeper relationships than they actually do. This disorder often develops in early adulthood and is more commonly diagnosed in women. It is classified as a cluster B type personality disorder. This group of disorders is characterized by more dramatic, emotional, and erratic behavior.
Thank you, Giselle. My name is Alice. I am also going to be discussing the path.
Histrionic personality disorder is a type of disorder that falls under the category of cluster B personality disorder. This personality disorder mainly manifests as theatrical, overdramatic behaviors, impulsiveness, self-harming behaviors, suicidal thought, and behaviors distorted self-image, fear of abandonment. Histrionic personality disorder is a mental health condition characterized by excessive emotion, attention-seeking behavior. People with histrionic personality disorder often feel uncomfortable when they are not the center of attention and may engage in provocative behavior to gain approval or admiration from others. Base personality disorder may require hospitalization during a period of active symptom expression, or when the client is being exposed to a lot of stressors. They tend to be overly sexual, seductive, having high provocative behavior. Their mood shift very rapidly, and they can be very shallow emotionally. Patients with histrionic personality disorder use their physical appearance to draw all attraction to themselves. They can be easily influenced. As far as clinical recommendation, provider must rule out and treat other conditions that may contribute to cognitive impairment. Usually, patients suffering from histrionic personality disorder are usually managed in a community setting, and some cases hospitalization may be needed once the symptoms are active. Provider can use pharmacological as far as selective serotonin reuptake inhibitors, anticonvulsant, or mood stabilizer. In some rare cases, benzodiazepine. Non-pharmacological dialectical behavior therapy, structure environment, protective self-harm. When it comes to referral in education, referral can be case manager, therapy, follow up with mental health provider. Education can focus on skills such as self-awareness, challenging negative self-thought, develop coping mechanism, join a support group.